Hello, everybody, and welcome to Colton Nutrition TV and our show In Depth, where we bring you face-to-face with the leaders, visionaries, and innovators changing the world. Now, we are so excited to have our good friend, Dr. Izabella Wentz, on the show today.
Really super excited for this one.
Dr. Izabella Wentz holds a Doctor of Pharmacy degree and is regarded as an expert in clinical pharmacology. She herself was diagnosed with Hashimoto's thyroiditis back in 2009, and since then she has made it her mission to discover the root cause of her condition and help others do exactly the same thing. She's also the author of the New York Times best-selling book, Hashimoto's Thyroiditis, Finding and Treating the Root Cause. Welcome to the show, Izabella.
Hey guys, how are you doing today?
We're doing great. How are you?
Very good. It's so nice to see you again.
Oh, we love having you on. Now, first of all, everyone, I want you to know that we are actual friends, and we have a lot of people on the show, but we just kind of like fell in love with her when we met her because, first of all, she's a pharmacist, which brings so much actual knowledge to the table and a different kind of knowledge than most people actually have. She understands a lot of things. We'll talk about that later.
Yep.
And also, she works with her husband, which we have to say we love as well. So we are so excited that you're going to come here. And you come from, actually, I think I really love talking to you all so much because you come from a very similar place that I do. You come into this because you're passionate about it. So how exactly did you become so passionate about the thyroid?
In full disclosure, I had to be passionate about the thyroid because there was nobody else out there that was going to help me as much as I was going to help myself. When I got diagnosed with Hashimoto's in 2009, this was after about a decade of having some really severe debilitating fatigue. So I was sleeping for 12, 13 hours a night. I also started having a lot of different symptoms like carpal tunnel, acid reflux, irritable bowel syndrome. I started to have panic attacks. So my poor husband, who you guys know and love and who's the sweetest man in the world, he would go out for a jog and he would tell me that he'd be back in a half an hour, and I'd start crying and start having panic attacks thinking that basically he ran off with another woman or that he got hit by a car or that something terrible happened. So, I just my life had started falling apart where I was in my 20s and then all of these things were happening, and one by one it was like my body had started falling apart. Right around age 25, so I went from being a relatively healthy person to all of a sudden having just these debilitating symptoms that were interfering with my life. So I wasn't able to really socialize with my friends. I wasn't able to really go out much. I wasn't able to speak up at work because of this terrible anxiety that I had. And I also had this horrible acid reflux that would act up at the most inconvenient times. So if I was speaking with a patient, I would get this horrible acid reflux and cough. If I was in the middle of a presentation, it would just pop up. And so, really I felt like I was losing a big part of myself. Part of me was very relieved when I got the diagnosis of Hashimoto's, but another part of me really wanted to know what happened. What did I do to develop this condition? Is there anything I can do to prevent its progression? So many people don't know, but if you get diagnosed with one autoimmune condition, which Hashimoto's is, you're more likely to have additional ones in the future, which may be more serious, like lupus or rheumatoid arthritis. And then I also wanted to be sure that I was able to live my life to the fullest and doing everything on my end that I could do to make myself better, to be my own advocate. And that's kind of how I became interested in the thyroid. And during pharmacy school, it was never a big interest for me, but after I graduated, I just really had to. So I dove into the research, and I dove into the different lifestyle interventions and some of the natural medicine things that I was not trained in, and just trying to figure out what worked and what didn't work. And I became my own guinea pig in an effort to get myself better. And yeah, I'm really glad that I was able to go through this journey. So now my focus is basically helping other people with thyroid disease and autoimmune disease to get themselves better.
And you're helping a ton of other people. I mean, New York Times bestseller over and over again, because there are so many people suffering with thyroid problems right now, and you're there shining light, giving them some hope that they too can understand it better.
Yeah, I mean, knowing you personally, it's hard to imagine you in this state with this anxiety, and you're just such a vibrant person, And so let's talk a little bit about Hashimoto's, and I think a lot of people might have a question like, what's the difference between like hypothyroidism and Hashimoto's? What's the differentiation there?
You know, that's a really great question. And so basically, hypothyroidism is a clinical state in the body when somebody does not have enough thyroid hormones circulating. And this can occur for a variety of reasons. One of them is nutrient deficiency, specifically iodine deficiency, and that's number one worldwide reason why people might develop an underactive thyroid. However, in the United States, the primary reason for having an underactive thyroid is because of a condition called Hashimoto's. And this accounts for probably 90 to 97% of cases of Hashimoto, of hypothyroidism, depending on the research that you look at. And this is also the case in Europe, as well as in Australia and parts of the world that add iodine to the salt supply. So in Hashimoto's, what's happening is that your thyroid is not actually sluggish, it's not lazy, it's not slow, but it's actually under attack. And it's under attack by your very own immune system. So in Hashimoto's, our body stops recognizing our thyroid gland as a part of our own body and sees it as a virus or some sort of a foreign bacteria that it needs to attack and eradicate. So essentially what happens over time is that the immune system starts breaking down the thyroid to the point where a person becomes hypothyroid, where their thyroid is no longer able to make enough thyroid hormone. Right. And that's kind of the difference. You can have Hashimoto's in the early stages. You might have normal thyroid function. As the Hashimoto's progresses, as the attack on the thyroid lasts longer and gets more aggressive, then you're going to develop hypothyroidism. And I would say, you know, if you're somebody at home that's listening and if you are taking thyroid medications or you've been told that you have a sluggish thyroid, there's a more than 90% chance that it's going to be due to Hashimoto's.
And, okay, so how would someone even have an idea that this is going on in their body? So it's not that, you know, you just go get the test, but obviously there's some symptoms that you have to be aware of first.
You know, thyroid hormone affects just about every cell in the body. So the symptoms can be very, very nonspecific. And a lot of times, you know, this condition is more common in women, but of course it can occur in men and children as well. But a lot of the symptoms will be very nonspecific. So people will go to their doctors and they'll say, I'm having the symptoms. And unfortunately, their doctors will say, oh, it's all in your head, you're a hypochondriac. But the symptoms to look out for are going to be having too much, an inability to lose weight or putting on too much weight, losing your hair, being fatigued. Fatigue is probably the biggest symptom that people experience. About 80% of people with hypothyroidism and Hashimoto's will experience this symptom. Another big giveaway is cold intolerance. So if you're the person that is, you know, in your office at work and everybody else is wearing a short-sleeved shirt and you're wearing a sweater and a scarf and a jacket and you're still a little bit chilly, there's a good possibility that you might have a thyroid disorder. Eyebrow loss. So losing the upper third part of your eyebrows is one of the dead giveaways that it's going to be a thyroid disease. Some of the other symptoms that are going to be common are going to be acid reflux, any kind of constipation or diarrhea, and then also, as I discussed, having anxiety and panic attacks. This can be a symptom of Hashimoto's, especially in the early stages. I've actually seen people who were misdiagnosed with bipolar disorder, psychotic disorders, panic disorders. I've even seen some people who were hospitalized because they had this thyroid disorder where basically they had too much thyroid hormone because too much of the thyroid gland was being destroyed, and then they don't have enough of the thyroid hormone, and then they become depressed. So, you know, one of my big soapboxes is to make sure that anybody with any kind of mental health issues, any symptoms like depression, you know, feeling agitated, feeling irritable, feeling anxious, actually gets tested for Hashimoto's and hypothyroidism.
Right. I mean, you just went down the list, and it sounds like every single 100% of the clients that come and see us, I mean, these are the symptoms that they come in with, and they say, you know, I've got this, I've got weight gain, I'm tired all the time. So how do we know if we have Hashimoto's? Are there tests that we can take that can definitively tell us?
Absolutely. So one of the tests that most doctors are going to do is if you go to them and you ask to have your thyroid tested is going to be the TSH test, thyroid stimulating hormone. And this is really an excellent test for very advanced stages of Hashimoto's and advanced stages of hypothyroidism, because at that point you'll see that the TSH is going to be elevated. The only problem with that test is when scientists first determined the reference range for what a normal person's TSH should be, they actually included people with thyroid disease in the pool of blood that was used to determine this normal reference range. And, you know, of course, the reference range was very lax. So at some points in history, they were saying that if you have a TSH of an 8 or a 10, then your thyroid was still normal, and not until it got above 10 is when you were considered to be hypothyroid. You know, to give you perspective, an average person without any thyroid disease should have a TSH right around 1. When my TSH was at a 4, I was sleeping for 12 hours a night, losing my hair, and having general pains all over my body. So this is something to consider. I always recommend that patients always get a copy of their own lab tests to look at those numbers, because the labs may have not adjusted to the right reference range, and your doctor might not even know about the correct reference range. So always get a copy of your own lab tests.
Okay,
but,
just clear, so where would you like to see those numbers come in?
You know, in a person that's healthy without any thyroid disease, that number should be below, the TSH should be below a 2.
Okay.
1 or 2.
So, right around 1 is going to be best. Now, this is not the only test to do, and a lot of times this test can be normal for, you know, you can have Hashimoto's for 10 to 20 years before you see a change in that number. So the other test that I recommend for everybody with any of these symptoms, because you can have symptoms even when your TSH is normal, is looking at your thyroid antibodies. So these are basically the antibodies that your immune system makes to the thyroid as it would to viruses or bacteria, telling your body that this is something that they need to attack. These antibodies are known as thyroid peroxidase antibodies, and that's TPO antibodies, and then thyroglobulin antibodies, or TG antibodies. And these are going to be elevated for about 10 to 20 years before you see a change in TSH, before you need to get on thyroid medications. And if you find these antibodies and if you treat them accordingly, you can actually prevent getting hypothyroidism, and you can prevent having to take medications, and you can prevent, you know, a whole host of feeling awful and a whole host of, you know, horrible symptoms.
So these are really the canary in the coal mines. I mean, if we can find these TPO and TG antibodies, then we're going to be able to do something about this before we actually get full-blown Hashimoto's.
Absolutely. So that's a big passion of mine, is how to prevent the condition from progressing. And so you can actually lower the antibodies. In some cases, you can completely eliminate the antibodies. The higher the antibody numbers, the more aggressive attack on your thyroid gland. So, you know, in somebody that has these antibodies, anything above 500 is considered particularly aggressive. And the higher the numbers, the quicker somebody's going to develop the hypothyroidism and all the symptoms that are, you know, associated with it.
Okay, so a question that, because I had to say, like, we maybe, you know, when we first started, we did not get so many emails regarding Hashimoto's, regarding hypothyroidism and all this.
I mean, like 10 years ago.
Like 10 years ago. Now it's really amazing. So why do we think that there's an increase? Is it just awareness and we're starting to actually feel comfortable talking about it?
You know, I think part of it is definitely awareness. So definitely awareness plays a big role in helping recognize that it's not just an underactive, sluggish, lazy thyroid, that it's actually the immune system attacking the thyroid gland. So I think there's a lot more push for that, and a lot more better diagnostics, and people are actually asking for the root causes, and there's a big push with different organizations to make more awareness about this issue. But the other component of it is actually environment. So when we think about autoimmune disease, we think about 3 particular things that need to be in place for the autoimmune disease to happen. One of the pieces is going to be the genes. So we need to have the right kind of genetic makeup to develop the autoimmune condition. The second part is going to be the triggers. So there are a variety of different triggers. Some of them are actually toxins. Some of them are foods. Some of them are nutrient deficiencies. And all kinds of different infections, including bacteria and viruses that can trigger the condition. The third piece of the puzzle, in order for a person to develop autoimmunity, is going to be intestinal permeability, or having a leaky gut. And you know, and with the way that our processed foods are nowadays, one can argue that more people are getting leaky gut, and then there's more toxins in the environment, and this can actually lead to higher rates of Hashimoto's. And you know, there have been connections with, for example, thyroid cancer has been connected with people who were exposed to Agent Orange during one of the wars. And so, anytime you have a more toxic environment, you're going to become at greater risk for autoimmunity and for cancers, which sort of go hand in hand.
Right. So, okay, so you mentioned there the root causes. So what exactly is causing this? You said some of the environmental factors, some food factors. What do you really think is the root cause of this?
For a lot of people, what ends up happening is that they have a period of really severe stress, and this really severe stress basically weakens their responses to the natural environment that they're in, and then they're going to be more susceptible to getting an infection. And this type of infection can trigger some sensitivities to different foods, and it can also take over our gut lining. And what ends up happening is the person stops being able to recognize foods as foods and stops being able to recognize its own body parts as its own body parts. And then this whole confusion begins to occur within the immune system. There are a variety of different triggers that are especially important in Hashimoto's. One of them is a selenium deficiency. So people who have not enough selenium on board can actually develop Hashimoto's. Another one that's been described is actually iodine excess. So in countries that before the iodine was added to the salt supply, they actually had higher rates of hypothyroidism due to iodine deficiency. Once the iodine was added to the salt supply, about 10 years later, they would restudy the population cohort, and they'd find that the hypothyroidism due to deficiency was no longer as much of an issue, but the rates of Hashimoto's had actually quadrupled.
Yeah.
So yeah.
I find that really interesting because we've talked about this before. You've said that a lot of times people come to us all the time and like, well, I've got Hashimoto's, so shouldn't supplement. Yeah, either they think they have an iodine deficiency, or they think that they shouldn't have iodine. And we've talked, and you've said that most people who have Hashimoto's don't have an iodine deficiency, but they still need iodine to help to support their thyroid.
So that's correct. And levels of iodine, I like to think of iodine as a Goldilocks hormone. So you have a little bit, we say scientists narrow therapeutic index, right? But it's a Goldilocks nutrient for fun. And basically it means that it has levels that if you have it too high, it can be a problem, and not enough can be a problem.
Right.
So, dosages that are found in, multivitamins, like 150 micrograms, are usually going to be okay for most people, even with Hashimoto's. People with Hashimoto's tend to be more sensitive, so any doses above like 400 micrograms a day may be an issue. So I know there are advocates out there that will recommend super high dose iodine therapy for a lot of conditions. And, and a lot of people have been helped by this super high dose iodine therapy, but Hashimoto's is not actually a condition of low iodine. It's a condition of not being able to properly process the iodine, because the thyroid gland is inflamed, and the thyroid gland is basically where iodine is processed. So if you're pouring more iodine on an inflamed thyroid gland, you're basically pouring gas on the fire. If you're doing too much of it, it can be a problem.
We always recommend people, we always tell people, you got to get the iodine in, but then you've got to get the synergists. You've got to get those micronutrients that help iodine become more absorbed. Things like selenium, vitamin A, vitamin E, iron, and zinc. Would you agree with that?
Absolutely. So selenium, iron, zinc, those are a lot of the very, very important nutrients that are required for proper thyroid function. So selenium is one of the supplements that I definitely recommend across the board. And I also recommend that people do other supplements as well. With iodine, I don't recommend that people go overboard with it. Some people will recommend even milligrams of it, which is 1,000 times, what I would normally recommend. Right. And a lot of times, people may have adverse reactions if they do the super high doses. But generally, if you're keeping them in balance with other nutrients and you're just doing the 150 micrograms, most people with Hashimoto's are going to be able to tolerate that, and iodine is not something that really gets stored in the body, so it's something that you would want to have on a daily basis, and just a little bit of it, not super high dosages, because that can cause more inflammation in the thyroid gland.
That's great.
Yeah, I remember when we first met, and we were just like, okay, we're supplement people, and we were like, okay, I don't know how she's going to feel about this, because we always hear Hashimoto saying you shouldn't have your supplement, you shouldn't take a multivitamin, and once we started talking, we were so excited that you are not only totally, obviously, because you're a pharmacist, understand the whole concept of getting the broad spectrum and how things work together in competitions and synergies, but also the fact that you even wanted to try it and that you take nutrients now because the fact that we actually have what you thought was a very good, formulation for people with Hashimoto's.
Well, I used to actually hate multivitamins because basically they poured everything into like one little capsule, and then you couldn't really absorb anything from it because, as you guys know, all of the nutrients compete with one another for absorption, and then you weren't getting enough of things, and then you were like basically having very expensive urine from taking them, and you're probably doing yourself more harm than good by taking most multivitamin nutrients, except for the ones that you guys make, because you guys have really done a nice job of separating them out so that you have, a nice way to actually absorb all the required nutrients and have the synergy happening that's necessary.
Well, thank you. And you know this already. Whenever we have got questions about anything to do with Hashimoto's, you're like the first person. You get the emails from us every single day. How does client write to us, asking us, and just send it directly your way? Because honestly, there's no one who's really helping more people on this topic than you are. So
yeah, absolutely. So you're listening right now. We are talking with the expert. This is our go-to expert on Hashimoto's, and I know the question that everybody wants to know is, can we reverse it? What are some of
how do I feel better?
What are some of the ways that we can actually work to get rid of those symptoms that you obviously were able to reduce to a great extent or eradicate completely?
Absolutely. So you can actually put Hashimoto's into remission, which means you can get rid of all of your symptoms. You can get rid of your thyroid antibodies where they're going to be either at very low levels or undetectable levels. And then in some cases you can actually, if your thyroid was damaged, you can regenerate some of that thyroid damage. Of course, this happens at a different rate for every different person, and different factors are going to play a role. But yeah, you can definitely reverse Hashimoto's. One of the things that I recommend for people is looking at your blood sugar balance. So making sure that you are having enough protein and fat with every meal, and so that you are not sending your body on blood sugar swings. Blood sugar swings can really anger the immune system and can cause a lot of an increased attack on the thyroid gland. Another thing that I recommend is looking at your food sensitivities. So having a gluten sensitivity as well as a dairy sensitivity, these are two of the biggest food sensitivities that I've seen in people with Hashimoto's. For me, getting off of gluten and dairy helped my acid reflux, helped me get rid of the carpal tunnel, helped me get rid of the IBS that I had for 5 years, and helped me feel a lot better. So some of these very simple things, the gluten molecule is thought to resemble the thyroid molecule, the molecule on the thyroid protein on the thyroid.
Okay.
Basically, there's something known as molecular mimicry, where your immune system recognizes one thing as a foreign body, and anything that looks similar, the immune system is going to attack as well. So whether or not, some people might have infections that they've had that look similar to the thyroid gland, like an H. pylori infection, that can actually trigger Hashimoto's, and getting rid of that infection can help people get rid of Hashimoto's as well. And some of the lifestyle things, of course, reducing how stressed you are, making sure that you make time for yourself, getting rid of antibacterial soaps in your home. So triclosan is a particular ingredient in antibacterial soaps that has been implicated in raising thyroid antibodies. So there's a lot of different simple things that people can do on their own to really help reduce the attack on their thyroid gland. One of the things that I love to do is I love to collect success stories from my readers and from my clients. My goal is to collect 10,000 in the next year. And, and we're getting a lot of stories submitted from people all over the world, and they've been able to dramatically reduce their thyroid antibodies, sometimes by 90%, sometimes by, getting them completely in the remission range, and people are getting rid of their symptoms left and right. So it's just amazing what really lifestyle change can do. One of the things that I talk about is looking at your nutrient deficiencies, food sensitivities, making sure that you're eating the right kind of nutrient-dense diet, and that should be a great starting point for most people with Hashimoto's if they're looking at reversing the condition.
Yeah, I mean, when you really look at everything that you're saying, it all kind of just, this map starts to kind of come into view. You've got the stress, and then that stress, as we know, it really causes you to become micronutrient deficient. That deficiency creates a susceptibility to be able to get these illnesses and these bacteria and these viruses that start up. We're such big believers in, as you know, getting rid of the sugar and the gluten. One of the things that we have questions with sometimes is the dairy. Now, of course, dairy with homogenization, lots of times they'll go in and they'll break up these fat cells. And if you've got the leaky gut, or if your gut is just not perfect, these fats then can kind of leak out through the gut and cause these kind of autoimmune conditions, or this attack on the protein as if it was a foreign body. Now, once people get their gut in check, can they come back and can they add dairy back in, or is this something they have to keep out for a prolonged period of time?
You know, it depends on the person. So for some people, they might have like just one primary food that they're going to be sensitive to forever. Oftentimes that food is gluten, where they just need to stay off of it for a very long time. For other people, it might actually be dairy. So they may be reactive to dairy forever and ever. Other people may have foods that they're reactive to. They might have a few more foods. But generally, as you know, a person heals the gut, they should be able to introduce the foods much more readily. In the beginning stages of Hashimoto's, when you're struggling, when you have a lot of thyroid antibodies and you have a lot of symptoms, I definitely recommend going on a gluten-free diet. So 80 to 90% of my readers that I've surveyed and clients have felt better going gluten-free. About another 60% feel better going dairy-free. And those are two of the biggest foods. For me personally, when I started off my journey, I was super sensitive to dairy, where, you know, basically being in a room with cheese would practically make me sick. It triggered my acid reflux, it triggered my IBS and bloating, and it actually triggered my carpal tunnel.
Right.
I've done food sensitivity testing every single year, where I've been able to track how sensitive I am to the dairy. And to the point where I am now, I am borderline sensitive, and I can actually tolerate small amounts of dairy, and I've had dairy on accident and, you know, on purpose a few times here and there, and I did not have any kind of reaction to it. And, you know, back in the day, I would have been bedridden for a couple of days having just one little tiny dose of casein, the dairy protein. But yeah, so of course I still avoid it just because I had such a bad reaction to it. But definitely for looking ahead on the horizon, people can heal their gut, and they can heal a lot of the food sensitivities.
Now, when you say to get rid of the sugar, do you also mean fruit, or are you just talking about refined sugar?
So definitely any kind of processed foods and refined sugar is out. You want to make sure that you're not eating those kind of foods, because they can really feed our pathogenic bacteria and cause blood sugar abnormalities. In some people, in some cases, they may also be fructose sensitive. So for those people, lowering the amount of fruit that they eat is going to be recommended as well. Other people, they might actually be very carb sensitive. They might have different gut infections that may feed on different kind of sugars and fruit. So for some people, you know, they may actually benefit from a very low carb diet in different parts of their journey. So I don't recommend any specific diet. I recommend actually tailoring the diet to the person's needs. But if I had to pick like a template, I would say something like the caveman diet or the paleo diet would be a good starting point for a lot of people.
Yeah, we probably agree with that. My only thing is that I think a lot of that is going in the way of sugar these days. So I think that there's a lot of the recipes you see coming out with, you know, paleo cookies, and you know, none of your ancestors made cookies, people.
Yeah.
It just didn't happen. And while it might be great for a snack every now and again, that should not be the majority of what you decide to make from the cookbook.
Yeah, well, as long as they stay away from the sugar, they're doing gluten-free, right? And then
it's not that hard.
It's not that hard. In fact,
and we're gluten-free. We don't have any sugar at all ever. And look at you. I mean, we've all eaten out to dinner together. No one's starved. That's for sure.
Yeah. We had fun too.
Absolutely. Now, okay. So, what are your best tips for feeling better? So, they're out there. They've got Hashimoto's. They're like, you know, I'm listening to this conversation. I want to feel better right now. What can I do?
You know, first and foremost, get rid of gluten.
Okay.
That would be number one.
That's for sure. That's out.
Number two would be the dairy, so get rid of that. Number three would be balance your blood sugar.
Okay.
So make sure that you get enough of good fats and good proteins with every meal, and eat every few hours. That's going to make you feel a lot better. Number four is going to be support your stomach acid. So one of the things that people can do at home is actually take a lemon, cut it in half, squeeze the juice out of both halves of the lemon, add some hot water to that, and add maybe you know, a little bit of maple syrup or a little bit of stevia if you're transitioning off this of the sugar wagon, and then just sip that first thing in the morning and throughout the day, and that's going to support your stomach acid production, and that can help you really feel better and increase your energy levels.
Right, so acid reflux does not come from too much acid. It's actually coming from too little acid, so you want to put some acid back in there to help the situation, correct?
You know, absolutely. One of the things with Hashimoto's and hypothyroidism, and when I used to work in the pharmacy, it was like, okay, thyroid meds were right next to the acid reflux meds because we just put them out together so frequently that it just made sense to keep them next to one another. But actually, people with Hashimoto's and hypothyroidism, there are numerous studies that show that they actually either have very low stomach acid and no stomach acid. And the symptoms are actually identical for low stomach acid and no stomach acids, or for having too much stomach acid. So you can have acid reflux when and get prescribed these proton pump inhibitors that further suppress your acid, suppress your nutrient extraction, and you end up actually making the situation worse when in fact you have low stomach acid. There is a supplement I recommend called betaine with pepsin that can be a dramatic change for people with fatigue and Hashimoto's. For me, it took me from, you know, basically sleeping 11 hours on thyroid medications to sleeping for 8 hours the next day and waking up bright-eyed and bushy-tailed and, you know, basically waking up in the morning and saying, this is it, I figured it out, I'm going to write a book about this, because it was the first time literally in 10 years that I was not exhausted. Right. And it's just amazing. So I have, for people that are more interested, I have the depletion and digestion chapter of my book at thyroidpharmacist.com/gift that people can download for free, and that has that chapter in there. And then, so last but not least, for number 5, I would recommend doing a selenium supplement. So 200 micrograms of selenium taken once a day has been shown to reduce thyroid antibodies by about 50% in people with Hashimoto's over the course of 3 months. Some people will say, okay, well, I take Brazil nuts, and Brazil nuts have selenium in them, and that's going to be enough. But you know, the Brazil nut selenium content is going to vary depending on the soil where the Brazil nut was grown. So, you know, if you have a Brazil nut, one might have 400 micrograms and another one might have 40 micrograms in it. And, you know, you say you take 2 a day, you know, you could be either underdosing or overdosing yourself. And selenium is another one of those Goldilocks nutrients that needs to be not too high and not too low. So they studied a dose of 100 micrograms, and that did nothing for thyroid antibodies. And then dosages, you know, above 800 are potentially going to be toxic for the body. So that's another thing to keep in perspective, is making sure that you have that important nutrient on board to help you reduce the attack on your thyroid gland.
Well, that's awesome information, and
yeah,
I can name like 15 people that I have to go share all this with, at least. So now, what's next for you? Are you working on another project right now? Another way to get all this great information out? I mean, your book is amazing, and it's hitting New York Times bestseller every single month still.
Yeah, if you haven't grabbed it, if you have Hashimoto's, if you know somebody who has Hashimoto's, if you're just interested in learning more about Hashimoto's, grab that Hashimoto's Thyroiditis from Amazon. You can get it all over the place, can't you? Hashimoto's Thyroiditis, Finding and Treating the Root Cause. It's an excellent, can't recommend it enough, excellent must-have book. So yeah, so how can people get more information from you? Where can they find these great little tidbits of information where they can download, read more, all that?
You know, if they go to Thyroid Pharmacist, I actually have set up a special gift for them. They can go to thyroidpharmacist.com/gift, and there's going to be a nutrient depletion and digestion chapter of my book that goes over using selenium. It'll go over the betaine with pepsin, and as well as some of the other very helpful nutrients for Hashimoto's. I'm going to have a gluten-free quick start guide, because there's ways to go gluten-free the right way, and there's ways to go gluten-free the wrong way. And I definitely did it the wrong way when I first went gluten-free myself, and I got myself in trouble increasing my thyroid antibodies by doing too much sugary gluten-free foods and by doing too much soy foods, which can also irritate the thyroid gland. And so that's going to be in there, as well as some recipes for people to get them started on the kind of, you know, paleo recipes that are actually going to be excellent and very nourishing. They're going to balance your blood sugar, and that are going to kind of they're going to be easy. So they're not going to be, anything that involves 75 different ingredients that you can only find in like remote places of the world. They're going to be things that are tasty and easy to make to help you transition into a very nutrient-dense diet to help support your body in its healing journey.
That's great. Well, make sure you get out there and you take advantage of this. So the website again was Hashimoto. What is it?
It's thyroidpharmacist.
Thyroidpharmacist/gift, right?
But we're gonna have a link to that, so nobody has to freak out right now.
Yeah. So, and you should know as well that in our new book, The Micronutrient Miracle, we've got an autoimmune protocol there.
Which we actually ran by the specialist.
Which, of course, we've double-checked it with you. So it's got all these great tips. So if you miss some of those tips, it's going to have all those things in it. It's going to be gluten-free, sugar-free. You're going to be able to increase your stomach acid. You're going to be able to do all that. So, well, this has been a great conversation.
Ooh, we have to leave her.
I know. Well, but we'd love to have you back again, and we can talk more about Hashimoto's. We can dig a little deeper next time. But thank you very much for being on the show. Do you have anything you'd like to leave our people with?
I just want to thank you guys so much for having me on the show, and for the listeners at home, if you're struggling with your health and with your thyroid and with Hashimoto's, I just want you to know that you can absolutely get better. You can really see a change, and one of the things you need to do is be your own advocate and learn as much as you can about your condition and take charge of your own health. So thank you so much for stopping in today and for doing just that and learning more about your health and taking charge.
Well, I know that our listeners love that, because we did it for my health, and we just want to say, like, look, it's another condition, but it's the same exact solution.
Yeah.
It's taking control of your body, learning about the nutrients, learning about the root causes of what put you in this situation, and making those changes. And we want everyone out there to know that regardless of what you're feeling right now, you can feel better tomorrow.
Yeah.
So thank you so much, Izabella, for joining us today.
It's always a pleasure.
And we'll see you next time
On In Depth. Thanks, everybody.
Bye.
Bye.